Start. So in the previous class we were discussing about atherosclerosis and telling you what will happen when atherosclerosis, the pathophysiology. Even though we'll not go into the depths of pathophysiology, I'll tell you the role of LDL in atherosclerosis, how LDL affects atherosclerosis, how it causes atherosclerosis. Now, even though the exact mechanism of atherosclerosis is unknown, what we do know is that there is some problem. It initiates with a problem either in what you call excessive amount of oxidized LDL, or it might be a problem in the endothelial cell layer. So in your tunica intima, so so imagine this is your tunica intima, and okay, you have your tunica intima. Under that, you have your tunica media, which is the smooth muscle layer. You have smooth muscle cells in them. So just use a different color for them. Let's suppose these green dots represent the smooth muscle cells. Okay, and under that you have your tunica adventitia. Now the problem here is that one way or the other, your LDL molecule, low density lipoprotein molecule, containing the fatty part and proteinaceous part, let's suppose it is like this. Okay, this fellow will enter inside. Okay, so one of the first steps will be, as soon as this fellow LDL enters inside, it gets oxidized, and that oxidized LDL will cause a reaction in your what do you call endothelial cells, in which your macrophages, or specifically your monocytes, will enter your tissue space, become macrophages. Okay, and they will engulf these LDL, oxidized LDL molecules. So you will have several LDL molecules present inside your macrophages, whatever are entering inside your intima. I'll repeat once again what is happening here. The problem arises, though we do not know the exact cause of atherosclerosis, how the initial point occurs. What we do know is that LDL, so this fellow will enter your endothelial lining. Okay, your tunica intima, it should not be present there. Okay, it is an foreign body with respect to your blood vessel. Normally your blood vessel should not have any LDL molecules. So as soon as this LDL gets inside your tunica intima, your endothelial cells will start attracting monocytes. These monocytes will migrate, undergo diapedesis, and they will enter your tissue space, becoming macrophages. These macrophages are phagocytic cells, which now macrophage का काम क्या है? Engulfing or phagocytosing foreign molecules. Here the foreign molecule, being LDL, is phagocytosed. So this fellow will get phagocytosed, and several such molecules, whoever are entering inside, they will get phagocytosed. They'll be eaten up by your phagocyte, your macrophage specifically. Okay, macrophage is represented by M5. Okay, here macrophage at one point of time, whenever it is engulfing your LDL, okay, it will be called a foam cell. So just write down one simple formula: macrophage plus, okay. So this is how it goes. If you have a macrophage that is engulfing cholesterol, or it is engulfing LDL molecules, that particular cell is called foam cell. Okay, that is one of the first steps. Formation of foam cell is one of the first steps that will occur. Stage one of atherosclerosis. These foam cells will start getting accumulated. This is a hallmark of your atherosclerotic plaque. It starts off with the vertical formation of foam cells. You will have several macrophages entering your intimal space like this, which engulf the LDL that is coming in, and they will become foam cells. All of these will represent foam cells. Okay, I hope you are understanding till here. If you want me to repeat any part, please let me know. Okay, so now what will happen is, from here So if I look at it a little more objectively, it will look like this. So let's suppose this is the inner layer of your the lower layer, same lower layer I'm drawing here in a way that, let's suppose this is tunica intima and this is tunica media and this is your tunica adventitia or tunica externa. You will start having plaques being formed like this. Okay? That foam cell will form a plaquey layer, okay, containing cholesterol and all. And another thing is that those foam cells at one point of time they will die. Once they run their course and once their lifespan is over, they will die. And whenever they die, they will release all the material that is present inside, meaning those cholesterol esters. They will release those lipids, oxidized LDL. All of them will come out. So in this space, here in this diagram, second diagram that you can see, you'll be able to see a lot of cholesterol molecules, oxidized molecules that are originally present. You can see oxidized LDL molecules and cholesterol esters that are being released from the macrophages, and you can see foam cells. So all of that will occur at the same time. Okay. Now the progression of atherosclerosis will occur in such a way that this fellow initially will start pushing down. Okay, a different color, one second. This fellow will start pushing down. So your blood vessel will literally bulge like this. So let's suppose this is the upper layer. This is the upper layer. This fellow will start bulging. Yeah, it will start going into your tunica media and it will bulge. Okay. So this fellow is basically increasing. यहाँ पर because of LDL coming in and getting stored and macrophages coming in, an inflammatory reaction will occur. So those cells will also start accumulating in this area, because of which you will have a small inflammatory reaction and this will start pushing down. Ultimately what happens is, at one point of time, uh, this fellow will start pushing up slightly. A plaque will start forming. Okay. So those three same layers I'm representing here. This is your tunica intima, this is your tunica media, and the tunica externa or adventitia, whatever you call it. Okay. Now यहाँ पर क्या होता? You will have this fellow expanding as much as possible. There are foam cells, your LDL coming in and pushing the limits of your tunica intima into the into blood, into the serum. Basically, your tunica intima will expand literally. Okay. And what happens is, if you can see this layer, this luminal space or the diameter of your blood vessel, that starts shrinking specifically at this point. Look at that diameter and look at this diameter. It is shrinking, right? Yahan se it has shrunk this much. So that happens. At the same time, what will happen is you will have fibrous proliferation, that is stage 3, wherein what you call collagen and smooth muscle cell. So whenever you have LDL molecules being present here, inflammatory cytokines being released here, inflammatory reaction occurring here. So here there is an inflammatory reaction. Okay, I'm just abbreviating as IFN. This will start stimulating your smooth muscle cells. So the smooth muscle cells that are present here, they will start proliferating, and at one point of time what happens is these smooth muscle cells will start migrating into intima. Okay. So I'll repeat once again. We are starting off with LDL that is coming into your endothelial layer. It is getting oxidized. Those oxidized molecules should not be present normally. LDL itself should not be present in your tunica intima. This will trigger, or it will literally, yeah, it will trigger a reaction from your monocytes. So monocytes will start invading the space of your tissue and they will engulf, they'll become macrophages and they will engulf this LDL molecule, becoming foam cells. Ultimately what happens is foam cells will start getting accumulated and some of them will die, right? And they will start pushing into the layer of tunica intima, pushing it out literally. During this period of time, there is an inflammatory reaction which will trigger your smooth muscle cell to proliferate. So there will be literally hyperplasia of your smooth muscle cells. the number of smooth muscle cells will increase, and at one point of time what will happen is they will start invading, or they will start migrating into your tunica intima. They should be present in your tunica media, but they'll start moving into your tunica intima. At that point of time what will happen is these smooth muscle cells, while migrating, they will also release a few chemicals like collagen, and they will release something called fibrin. Okay, all of this time what is happening is this layer which you can see, this fellow is starting to go up, meaning this fellow is becoming bigger, or it is becoming thicker, in the sense that now this fellow looks like this. So there is more and more LDL molecules coming in, and more foam cells being accumulated, and the lumen of your blood vessel narrowing even more. Okay? And at this point of time what is happening is your fibrin strands, let's suppose I draw with blue, the strands of your fibrin and collagen start getting accumulating here. During this period of time, whenever fibrous strands or collagenous strands start coming into this area, that area will start becoming thick till stage 2, wherein only your LDL was present, smooth muscle proliferation did not occur. The what do you call state with the progress of atherosclerosis can be reversed, meaning if you simply decrease the LDL levels in the patient, you might be able to bring them back to normalcy. But once you have fibrinous invasion, and once you have what do you call collagen invading into that area, wherein inflammation will become chronic inflammation, at that point of time it will be very hard to remove that plaque. You'll have to intervene surgically or something like that, or you have to give drugs. Simply decreasing the LDL levels will not do. Okay, because this fellow will become very thick because of the presence of collagen. Now all of this time what is happening is the luminal space, or the diameter of your lumen, is decreasing. Now see, this was your normal size diameter, and it has become this much. At one point of time what will happen is your endothelial cells will not be able to take this much pressure, and they will break, they will literally rupture. So you will have, let's suppose, rupture of your endothelial cells like this, and this fellow is exposing, this fellow is getting exposed out, your LDL molecules, your foam cell. So this fellow right now has foam cells plus macrophages, foam cells, macrophages, your collagen, inflammatory cells, cytokine specifically, and it has fibrin लिखा है, ठीक है, all of this plus dead macrophages which in turn released more LDL and all of that. So you'll have more oxidized LDL. So all of this will be present in that plaque. Okay, whenever you have this kind of structure which is vertical pressing into your blood vessel, and it becomes hard and what do you call sclerotic, your blood vessel will become sclerotic, it will lose its agility at that point. Okay, now normally your blood vessel is very agile, it is very something like rubber band. Okay, it can expand under the presence of more pressure, and it can what you call contract if the pressure is decreased. It is very flexible in that sense. This area which is undergoing atherosclerosis will become sclerotic. This area will not be flexible anymore. Okay, and it will break very easily. That happens when what you call rupture occurs, whenever this fellow inflammatory process is pushing into your endothelial cells, and ultimately your endothelial cells will give up and they will break. At this point what will happen is whenever there is breakage or damage into your blood vessel, immediately thrombosis occurs, clot formation. Okay, so here clot formation starts and thrombocytes come into picture, your platelets come and form a clump. Now see what is happening to that blood vessel. What ends up happening is at one point of time this fellow will get completely blocked. This is an atherosclerotic plaque. Okay, this whole structure is referred to as a atherosclerotic plaque, wherein your blood is not able to flow completely outside. Now, in some patients, what will happen is it will be decreased in the sense that a little bit of blood can go through, but blood supply will definitely decrease. Or in some patients, you will have complete blockage as well. So you will have something like this. Okay. This is what happens in atherosclerosis. At one point of time, what will happen is whichever organ this blood vessel was supplying, that will undergo necrosis because of lack of oxygen and lack of nutrients. Right? This is your atherosclerosis. समझ में आया how it is working? Or do you want me to repeat any particular part? Did you guys understand what is atherosclerosis? You can put it in the chat as well if you still have doubts. Okay. Now, coming to symptomology of your atherosclerosis, symptoms of your atherosclerosis will be related to whichever part of your body is being affected. So let's suppose whichever artery or whichever blood vessel is undergoing atherosclerosis, that part will get affected more. So for example, generally what happens is you will see angina, chest pain, a lot of chest pain, or pain in limbs, legs or arms, or anywhere whichever artery is being blocked. You will have shortness of breath. You'll not be able to breathe properly. There'll be a lot of fatigue. Okay, especially if there are several atherosclerotic plaques present in your body, that time you will have fatigue, confusion. If specifically circulation to brain has decreased, you will have confusion. I'll just write them down. Angina, that is chest pain, uh, limb pain. Okay, and you will have SOB, shortness of breath, fatigue, confusion. If okay, and you will have muscle weakness. All of this fatigue, pain, and that is because of lack of proper circulation. Okay, because blood is not able to reach that particular part of your body because of the blockage, you will start having pain, and at one point of time you will start having a lot of weakness plus fatigue. You will be very weak as well. Okay, now the way you diagnose atherosclerosis is, one, you can do blood picture, CBC, to find out the cholesterol levels and blood sugars that are present in the body, because it is directly correlated that the higher cholesterol someone has, especially if someone has very high LDL levels, there is a very good chance that the person already might have atherosclerosis, or they might be suffering from advanced stage atherosclerosis where irreversible plaques are formed. You can do an angiogram to find one particular blockage, or you can perform ECG, or you can do something called a stress test. Stress test is something in which you will measure the exercise tolerance of the body, in the sense that one common stress test is this thing. You can administer adrenaline in some patients who are not physically active or who cannot be physically active, or if someone is able to walk or run, something like that, you will what do you call, set up a device, the stress test device, and you will make them jog, or you will make them walk, and see their response of the body. How much are they able to tolerate, what how much are they able to tolerate, and what is their cardiovascular capacity. Based on that also you can diagnose whether the patient has atherosclerosis and to which degree they have atherosclerosis. Okay, now treatment will obviously include something, drugs that can decrease cholesterol levels, or they are called hypolipidemics. Sometimes you'll have to perform surgery, different kinds of surgery, bypass surgery, thrombolytic therapy, or angioplasty. Depending on the condition, you will perform different kind of surgery, sometimes atherectomy. uh, there are non-pharmacological solutions as well, as in without drugs, things like eating a better healthy diet with low saturated fat and cholesterol, avoiding fatty foods, especially those fatty foods that are what do you call, how should I put it, street based, in the sense that if you're not able to monitor the amount of fat that was going in, if you're not able to control what is happening in that diet. So for example, let's suppose you are eating fried rice. The fried rice generally has a lot of oil in it because it is fried. uh, if you are making it at home versus if you go out and eat it, there'll be a huge difference, specifically because you are able to control the amount of oil and control the amount of ingredients that are going in. You cannot do so when you are eating outside or things like that. Okay, again, you have to manage. And physical exercise, 30 to 60 minutes per day, almost 6 days a week, 3 to 6 days a week, some form of activity. It can be any sort of exercise. Adding fish to the diet. Fish has something called omega fatty acids, which are very, very good for your cardiovascular system. uh, if you're a smoker, then you should completely avoid smoking or quit smoking. Same goes for alcohol. If someone has a habit of drinking excessive alcohol, they should try to control their habit, right? And managing stress management will have a direct impact not just on atherosclerosis. It will have an impact on hypertension. It will have an impact on cholesterol levels. It will have an impact on diabetes if the person has all of those. Okay, so these are some of the measures that you can take other than taking direct treatment, that is drugs itself. Okay, so that is about atherosclerosis. I hope you understood the topic. Now coming to the last topic in your lipids, ketone bodies. So if we are done with ketone bodies, this will be the last class for BSc people. People who are from this thing, post BSc, you guys have one more topic, water and its water and electrolytes or something, the third chapter that we have to do for you. I think BSc को already कर दिए थे, so I need not tell it again. Tomorrow's class we'll try to do that if we are able to finish this ketone bodies in this class itself. Okay. Now, what are ketone bodies? There are specifically three important ketone bodies that are produced in your body, okay, in special conditions. The names of those are beta hydroxybutyrate, acetoacetate, and acetone. What are these three and why are they significant? Now, these are water soluble molecules. Okay, they are a product of spontaneous breakdown of acetoacetate. Generally what happens is whenever someone is in what you call, someone who is fasting, someone who has not eaten in a long time, or who is generally fasting, or someone who is in a carb restrictive diet, carbohydrate restrictive diet, specifically something like keto diet, carbohydrate restrictive diet, or if someone is starving, who is undergoing starvation or suffering from starvation, or who has undergone prolonged intense exercise for a long period of time, they have been exercising, or alcoholism, or untreated diabetes mellitus. In all of those conditions, so I'll just write some of the significant ones: untreated or poorly treated, DM1, sometimes DM2 as well, diabetes mellitus 2 and 1, um, alcoholism, starvation, fasting, carb restrictive diet, ठीक है, among them, and sometimes intense exercise. In all of these conditions, what will happen is the reserves of glucose in your body, whatever glycogen is present in your body, that will be broken down, and your body obviously needs glucose to survive for normal metabolic processes. Whatever amount of glucose that is present in your body, once you eat, see, whatever you eat generally gets digested and broken down and what you call used by around 2 hours or so, 2 or 3 hours. Okay, but generally you do not eat every 2 3 hours. You will feel slightly hungry maybe at the end of 2 3 hours, but it is not so much so that you immediately need to eat. Sometimes people don't even feel hungry. You can go up to 6 to 8 hours without eating, wherein you'll have a major meal. Okay, generally, again, it will depend on your own diet and your dietary processes, how you eat, how many meals you eat in a day, how you divide your food. But generally speaking, once you eat, after 2 3 hours, whatever you have eaten will be broken down and then used up depending on the amount you are eating. Let's suppose you are eating just enough to maintain enough amount of calories, or you eating at maintenance calories, wherein all the metabolic processes are being what you call met, or the metabolic needs are being met. So for that amount of time, whatever you are eating will be broken down, and whatever excessive amount is necessary for metabolism will be taken up by those glycogen reserves present in your body. So you will have some glycogen reserves in your body. Those will be broken down into glucose, and that glucose will be used by your body. Now, in such conditions where someone is having type 1 diabetes, or in type 1 diabetes, glucose cannot go inside, or alcoholism, or starvation. In alcoholism, excessive what you call aldehyde will be present in your body, will start hampering or it will start inhibiting the function of your liver. Or starvation, where you do not have any food altogether, or if someone is fasting is different from starvation. Fasting is limited. For some amount of time the person is not eating, let's suppose for a day. Starvation is they are not getting particular nutrients or all nutrients for a very very extended period of time. And carb restrictive diet is something where people do not eat carbs altogether, or at least try to minimize the amount of carb as much as possible. In all of these conditions, what will happen is the glycogen reserves in your body will get completely depleted. See, there is a certain amount of glycogen that is present in your body used for emergency purposes. Okay, the emergency janda, whenever you do not have enough amount of glucose, that glycogen will be broken down. Here we are talking about a condition where all of those glycogen reserves are also used. So what will happen at that point is, along with glucose, so let's suppose all of your glycogen reserves have been used up. Okay. Now you cannot get any glucose from glycogenolysis, which is the primary source. Your body will go into a state where the body will start producing, or specifically your liver will start producing a lot of glucose through non-carbohydrate sources, in the sense that through gluconeogenesis. So in gluconeogenesis, if you remember, from pyruvate we are making glucose. That is through a non-carbohydrate source, because it is not coming from a carbohydrate. No, it is not coming from the food that you eat, or it is not coming from any carbohydrate source. That is gluconeogenesis. So gluconeogenesis occurs in your liver, plus your liver will also start producing these ketone bodies. So I'm just abbreviating it as kb. Ketone bodies will being produced along with glucose, because your liver has only so much limit, or it has a certain limit to how much amount of glucose it can produce. It will be directly dependent on the amount of pyruvate present. If 100 molecules of pyruvate are present, you'll be able to make around 50 glucose molecules. Okay, your body generally needs more than that. In that sense, your liver will specifically start making ketone bodies. The significance of those ketone bodies is that glucose, now obviously this fellow will go into your cell, it will get broken down and it will be used for metabolism. Ketone bodies will also act as a source of energy. What happens is, whenever ketone bodies are secreted out of your liver, I hope you are understanding till this point. Please feel free to ask me doubts if you are not understanding. Okay. What happens is, these ketone bodies are secreted out of your liver, secreted into blood from liver with glucose. Again, this glucose is glucose that is produced by pyruvate. The amount of glucose that your liver can produce is limited. It is not infinite. It cannot keep on producing enough amount of glucose. That is why, to meet the energy needs, ketone bodies are also produced. These ketone bodies specifically, what happens to them is, they will enter your blood, and they will enter particular cells. So let's suppose it enters skeletal muscle, or any cell for that matter. Okay, or any standard cell. Once it enters cell, it will be converted into acetyl coenzyme. These ketone bodies get converted. Acetyl coenzyme A. This acetyl coenzyme A will directly participate in TCA, citric acid cycle. Acetyl CoA participates in TCA to produce ATP. ठीक है? This is how ketone bodies are used, and this is their significance. If it can be your brain, it can be anywhere in your body. Okay, these ketone bodies are a substituent for energy because your body does not have enough amount of glucose. It is producing ketone bodies which are acting as a source of energy. But what happens is during this process, your what do you call, your blood will have a lot of ketones, and this state is called ketosis or ketoacidosis. Your because ketones are acidic in nature, they will decrease the pH of your blood. Along with that, you will have a characteristic smell. uh, your breath will have a characteristic smell because you are producing so many ketone bodies. The person's smell will be literally like it will be fruity, or it will be like nail polish remover. That kind of smell will start coming from the person's mouth. That is because of the presence of acetone. Acetone has that kind of smell. This is a detrimental state. This is a state in which the person is already in starvation, or they are in ketoacidosis because of a abnormal condition like, you know, diabetes or starvation or alcoholism or carb restrictive diet. This is not something that your body can sustain, and it will have a lot of repercussions down the line. Okay, that is why ketoacidosis is a complication of diabetes. Whenever someone has diabetes, one complication that will occur in their body is ketoacidosis, because your body is not able to take in glucose. When glucose is not being used, your liver will start producing another source of energy, which is ketones. Those ketones will start accumulating in your blood and start decreasing the pH of your blood. It will do several other things, and one side effect of that is your breath will start smelling very fruity. Okay, that condition is called ketoacidosis or ketosis. So this is about your ketone bodies. All right, with this we have completed your biochemistry portion. I hope you understood this, and I hope that you study diligently. Okay.